so nice to see you. You're a little bit early.
Nice to see you guys.
Everybody, this is Zain. He's from the school's newspaper. He's just going to be helping us record the demo today that we're doing just shortly. We're just finishing up lecture here, so just give us a couple minutes. We have time for 2 to 3 more questions. Does anybody have a question?
I have a question.
Jeremy.
So, what is an NG tube?
Great question, Jeremy. A nasogastric tube, or an NG tube, now made of polyethylene. Actually, fun fact, it used to be made out of a vinyl material, but it would harden once it sat in the stomach's juices, making it very uncomfortable for the patient. And the polyethylene tube also has a longer longevity. So just a better tube in general. The NG tube is inserted to patients through a patient's nose, through their posterior oral pharynx, down the esophagus, and threaded into the stomach. The procedure is common for unconscious patients, those with no gag reflex, those who need stomach gastric emptying due to obstruction, or those that need nutrition. Anybody else have a question? Em.
So where did NG tubes come from?
That is a fantastic question, Em. So parenteral nutrition and enteral nutrition have a very long history dating back to about 3500 BC. The ancient Egyptians, Chinese, and Indians used it. Their medical practices were the first reports of enteral feeding therapy provided via rectum, with things via enema, with things such as honey, milk, wine, barley, whey. Does anybody else have any other questions? Van Am.
So what are the contraindications?
Well, so the contraindications, and they're on the board, so can somebody please answer that, Van Am? Am.
So that would be basal skull fractures, esophageal varices, severe facial trauma,
Yes.
nasopharyngeal or esophageal obstructions or strictures,
Yeah.
recent ingestion of caustic substances, or diverticula.
Very good. Very good. All right, sorry, we're out of question time now. We have to run to the demonstration. Can the students in this classroom please line up the door and go to their next class? We'll be seeing the older students do the NG insertions in. So if we could just back up a little bit and walk with me, walk and talk. How's that sound?
It sounds good, man.
Perfect. Just so you know, Zain, this demonstration is basically going to be based off the idea of denoting air auscultation for NG tubes. Multiple case reports indicate clinicians cannot differentiate between respiratory and gastric placement using air auscultation. There's no evidence to indicate the auscultatory method is useful for determining tube placement. In 2012, the Child Health Patient Safety Organization issued an alert recommending immediate discontinuation of this method. Several other health advisory boards have followed suit. X-ray confirmation is currently the gold standard, yet air auscultation is still taught to nursing students and used in some AHS sites. So Zain, I'll be leaving you here briefly. We're actually just going to do an improper demonstration with a couple of students we have, but this is the room where we're going to do the proper demonstration of the NG tubes. Nice seeing you. I'll talk to you later. Be safe.
Thanks. Take care, Dr. Macleod.
Hi, Jeremy. Today we're going to be inserting your NG tube, so I'm just going to go over the steps in the process with you, and then if you have any questions for me, let me know. Okay, so the first thing we're going to do is we're going to start by measuring the NG tube and see where it fits. So we're going to start measuring from your nose up to your ear, and then down to the xiphoid process. Perfect. And then from there, we add on 5 centimeters. So currently, we are sitting at 55. Okay, I'm going to get you to tilt your head back. We're going to check the nares. Okay.
Don't forget air auscultation!
No. Okay, so we're just going to tape it down to your nose using an NG strip. Your glasses might get in the way. Perfect. Now we're just going to wrap it around our tube here. Okay, perfect.
So when you had him swallowing the tube, why did you have him tilt his head down?
It helps guide the tube down the esophagus instead of into the bronchioles.
What can go wrong if it doesn't go into the stomach?
If it goes into the lungs, it could cause pulmonary edema, feet empyema, or pneumonia, which could all be fatal if not recognized early. It could also go into the skull if a patient has facial or skull trauma.
How do we know the tube is in the right spot on an x-ray?
The tube will be visible in the left abdomen below the diaphragm if it's in the right spot.
So does the patient need to go down for an x-ray?
You can perform Pivot's X-ray consultation.
Alright class, just to recap from yesterday's lecture, to confirm an NG tube placement, what are we going to use? X-ray. Perfect, that's the gold standard. Next, air auscultation is no longer reliable because we can't differentiate where the pop is coming from. That could be from the lungs, or it could also be from the abdomen, somewhere in there. And we're recommended not to use that anymore due to the dangerous that it poses for patients. We may see it in hospitals, but right now it's not being implemented in EHS currently.
I heard a scream. Oh my god.